we try to provide most of our patients with good information about this virus and clearly about the mode of transmission of this virus. Because we know from the past that patients with hemophilia who have been infected by HIV, HCV after blood transfusion, so these were blood contamination. Here, the transmission is totally different. So we clearly explain our patients that the mode of transmission was airborne, and for this reason, these patients had to minimize, to reduce as much as they could contact with other people, make sure that they could keep enough distance with other people, and also, and even more importantly, to wear this facial mask as much as possible. What we had to do very early during the pandemic was to inform our patients about the main symptoms that they had to recognize and pay attention to themselves at home. So we told our patients, please, if you develop fever, if you are unwell, if you develop chest symptoms, well, you should contact us. Please don't minimize this. Because we have to make sure that patients would recognize the very first symptoms of COVID-19. Well, clearly, we explained our patients that what they had to do is to continue their treatment. During this period of pandemic, when you are isolated, alone at home, you might be a little bit depressed, and that could certainly impact on your adherence to the treatment. We know that, the ideal treatment of hemophilia, of severe hemophilia at least, is prophylaxis. And we wanted to make sure that all our patients would continue their prophylaxis, that there was no need to reduce prophylaxis or to intensify prophylaxis. We also informed our patients that concentrate would be available and there was no need to try to save concentrate at home by reducing the amount that was used. So that was very clear. Clearly, what we told our patients, we also told them that it was important to remain physically active. This is important to preserve the joints, to preserve the muscles, and we told our patients that in spite of the fact that they had, for most of them, to stay at home, that they had to promote some sort of physical activity. This is what I would call self-physiotherapy. That means at home, being physically active as much as you can, and that was even more important during this period of pandemic. The other one is to minimize, or tries to avoid physical activity that would increase the risk of bleed that could take place at home. So we clearly told our patients it's not really the ideal time to embark, to start physical activity or activities that you are not used to that would increase the risk of bleed. Beyond prophylaxis, continue prophylaxis, and also promote, what could be good for health, for your musculoskeletal system. That means some sort of physical activity.